Every day, people just like you go to their doctors with insulin resistance. They're given a medication and then sent home. But it's an absolute fact that diabetes type 2 can be significantly improved, if not cured, by eating the right foods in the right amounts. So what do I eat, doc? That's what we're going to cover in this video. But before we get started, I'm Dr. Zyrowski, and I'm here to help you transform your health naturally, because true health only comes naturally. I was about 19 years old when my grandfather, who had type 2 diabetes, was sick in the hospital. And I remember them bringing him lunch. When they brought him his lunch, it was a white bread sandwich, it was Jell-O, and then a yogurt cup. Now, after he ate his lunch, a nurse came in and they gave him a shot. And I remember as the nurse was leaving, I asked my mom, what was that shot for? And she said, well, it was insulin for his diabetes. And then 19-year-old me, who knew nothing about health, thought to myself, well, why did they give him all that sugar if his body can't handle it? And at the time, once again, knowing nothing about health, and just like many of you who were taught to trust the medical system, I just figured, well, they know what they're doing, and I left it at that. For some reason, that moment's always stuck out in my mind, and looking back on it, I know why. Because it's absolute insanity that a young guy who knows nothing about health was able to pick up on the fact that they just gave a type 2 diabetic a load of sugar, refined carbohydrates, Jell-O cups, sugar-filled yogurt. When many of my patients come in who have type 2 diabetics, one of the things that they tell me is that their doctor gave them no information on how to change their diet. They handed them the medication and walked away. And many people don't even know enough to ask their doctor if they should be changing their diet, but they shouldn't have to, because their doctor should give them that information without asking. The reality is that the reason that you have insulin resistance is due to the very poor lifestyle that you've lived for too many years. The foods that you're eating is either going to promote healing or it's going to destroy your health. And after years of eating foods that are going to increase glucose and skyrocket insulin levels, your body becomes resistant to it. And that is why it's of utmost importance to make sure that you're no longer eating foods that are going to promote insulin resistance, but rather promote healing. So here's what I would do if I was in this situation. Almost everything that we eat is loaded with sugar. If you're following any standard diet, then most of the processed foods that you're eating are going to be loaded with sugar, but even some of the healthy canned vegetables are going to have some sugar in it as well. It's estimated that people consume upwards of 125 pounds of sugar every single year. If I had insulin resistance, sugar would be the first to go. Not even a taste of it. No white sugar, no maple syrup, no honey, no sugar at all. I would cut it all out. But sugar isn't the only thing that people eat in excess. Most people wake up in the morning and they have a big bowl of cereal, a bagel, or maybe even a fruit-flavored yogurt. Lunchtime comes around, they have a big turkey sandwich, and then for dinner, what they'll have is a protein, typically with some other carbs, or maybe even a big carb-filled dessert. Now, if I had insulin resistance, here's what I would do. I would cut out all carbs unless it was coming from good whole food sources. I would also remove all processed foods, and then I would take my carbohydrate count and I would drop it to about 50 grams of carbohydrates or less every single day. Because I would know that with my metabolic health being very poor like it is, that the carbohydrates will only do harm rather than good. The next big move I would make is I would cut out all foods that have laundry lists of toxic ingredients in them that I can't even understand. I'd also go and cut out grains from my diet. In essence, I would be cutting out all inflammatory foods or foods that can even drive the inflammatory response in the body. Type 2 diabetes has an inflammatory component, and if you're serious about reversing it, you have to do everything you can to shut down inflammation in the body. Many of us look at fruit as being healthy, and that's fine, because in most cases it is, but not at this point in time. If you're someone who has insulin resistance, your body can't handle large doses of sugar. If you look at a fruit like a mango, for instance, it has upwards of 50 grams of sugar in it. Now that's sugar overload for somebody who has insulin resistance. If I were to eat fruit, I would have fruit in moderation, and I would only eat berries. And this is why, because berries are low glycemic and they also are micronutrient dense. Now, for most people, protein and carbohydrates are going to be the foods that they consume in the highest quantity. But if I had type 2 diabetes and I were to look at my diet from a 10,000 foot overview, my macros would look like this. I would eat high fat, I would eat moderate protein, and I would eat low carbohydrate. Now, conventional wisdom would tell me that I need to eat about 6 healthy small meals a day. However, for me, with insulin resistance, I wouldn't eat like that. I'd skip breakfast and I would only eat lunch and dinner. But I would know that starting intermittent fasting would be a bit of a challenge for me at first. So I would start slow. I'd start probably around 12 hours of fasting, and I would slowly work my way up to a 16-hour intermittent fast. And I'm no fan of prescription medications either, unless it's last resort. The average American, 55 years or older, takes 4 or more prescription drugs. Now, I wouldn't want to cover up the symptoms. I'd want to get to the root cause of the problem. So I would look to nature for the most profound nutrients that are proven by science to bring down my blood sugar and balance my insulin levels. And by the way, what I'll do is I'll put a link in the description below to an amazing blood sugar kit that we use clinically. And most people believe that type 2 diabetes can't be reversed. But now, because I know better and you know better, we're going to do everything in our power to reverse this preventable chronic illness. To kickstart your ability to take control of your blood sugar today, watch this mini-series I put together for you. What is normal blood sugar? This is a really important topic because it affects everybody, not just people who are suffering from a condition, but everybody. Here's the thing that is really important about all of this.